Hey, what's up? This is Sensei, aka Donovan Green, or Donovan Green, aka Sensei. Today's video is for all of you who have had knee surgery in the past few months. Not if you recently had knee surgery, like a couple of weeks. This video is not for you. However, I'm filming this video for a personal client of mine, and I figured I'll just share the video with all of you. The movements I'm going to show you, it is not coming from a place of a physical therapist or a doctor. So make sure that you approve this with your therapist and your doctor. I'm going to show you some stuff that you should be practicing to get your knees stronger and the muscles surrounding your knees, all right? I have a chair and I have a Bosu ball. We're going to start off first from sitting down, and this is where I want you to work on getting that knee extended and bent. This is the most things we need to work on is straightening your knee and bending your knee. So the first exercise, I want you to extend the leg out. I'm going to go pretty slow. You're going to reach forward, slide the hand down. Good. Feel the stretch in the back of the leg. Go only as far as you can go, and then find where it's a little bit more uncomfortable and stay in that discomfort for a bit. Don't push through the discomfort, all right? Pull the toes in towards the shin a bit more. That's going to intense that stretch. Now, I want you to come up tall and then pull that knee in nice and slow. Once you get there, reach down and gently pull in a little bit more. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Let's do the same thing on the other side. Reach it forward, slide that hand down, pull the toe towards your shin. Take a deep breath, exhale, feel the stretch, get that leg as straight as you can. Now, some of you might have had surgery done on one side, while others might have it done in two. But we're going to treat this like as if we're doing both, okay? Pull that toe in towards that shin. We hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Come up slow. Grab that leg and pull it in a bit more. Get that bend for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, so that's exercise number 1. Repeat that for at least 12 times on both sides. I'll need repetitions out of you. The next exercise that I want you to practice is really focusing on if you have your hands, if you're able to do this with your hands. Because some of you might have arthritis in your hands and you can't really grab stuff. But if you're okay with your hands, I want you to come here and you're going to scoot yourself off the chair, bend, and you're going to come back. That's 1. Push off again, take your time, bend, and come back. That's 2. I'm going to do 8 reps here with you. Bend, come back. That's 3. The focus is to allow some gravity to take over by dropping that butt down some more. That's 4. Inhale, strong, bend. That's 5. I'm going down a little further every time. As time goes, you'll be able to get more range of motion in your bending. 6. I'm going to go for 2 more. That's 7. Let's go for 1 more. That is 8. Good. And relax. The thing about the knees is you're going to feel the stiffness. You're going to get a lot of swelling, right? And it's going to feel scary. But you have to be able to push through it a bit if you truly want to increase your mobility. If you baby it, you're going to build up a lot of scar tissue in your body, and then your doctor's going to probably have to go in and manipulate it again, which is very painful. Okay, so we want to push through it as much as you can bear. All right. Now, we're going to stand up. This is the first one that we're standing. Let me see. Let me use this chair. I was going to use that. I'm going to show you with this first. Some people can actually go down on their knee because they're at that point to where they can. So you want to get a Bosu ball or an Eric's pad, and you want to go in this position, get the heels back, and find where you can lean forward without the heels coming off the ground. Where can you go? Well, you don't want to do like this, okay? You want to keep the heels flat and see really where you are. What's the range of motion in your ankle? And you're going to stay there for about 15 seconds, come back out of it, and then repeat again on the other side, okay? If you're not able to get on your knee, we're going to use the chair. And if you can get your leg up, we're going to use the chair, find that position, and you're going to go forward. And notice how my heels are staying flat. You want to find that position. Now, when you get that, now you can rock back on this one, get this position here, lean forward, straighten your back up, get that bend, that extension, and then now you put the foot back, and you're going to go back here just like this, back as straight as you can, heels down, and then repeat. You see it? Got it? So that's exercise what? Number 3. Now, another thing for you to practice, which most people never think about when it comes to developing the muscles in those legs, is I'm going to do 2 things. I'm going to step back in the chair, step back away from the chair, right? I'm in this posture. I'm going to lift the heels up, come back down, then I'm going to sit back as much as possible where I have control, not to where I'm going to fall back, and then I come back up. Now, to be safer, if you feel nervous about falling, you can get another chair, and the chair will actually be a great guide, so you could actually sit in the chair if you need to. So it's going to look like this. I lean forward, get my position, back flat, you lift up, you sit back, and you could sit. See how the chair pulls forward? The chair moves with me, right? Now I'll go again up to a box squat, lift, come back down, take your time sitting down, keep the back as straight as you can, sit back. And then again, I'm gonna do 3 more. Up, lift, come down, slow, sit back, and up. See how my back stays straight, and up. I know it's gonna hurt there. It's gonna feel uncomfortable, but you have to push through it. This is the key. Your doctor will tell you that. Your physical therapist will tell you that. Let's go for 1 more. Up and lift. Okay? And relax. So that's exercise 4. There are many more to do, okay? And I'll show you 1 more exercise that you should be doing regardless, okay? You could use the chair as a support guide until your balance gets better, or you can use a stick. I'm going to use a stick because a stick will make me challenge myself a bit more than the chair. So I'm standing on 1 leg. That's all I'm doing. I'm going to stand on 1 leg here, and I'm going to go 1 and up, down and up. I'm bending and up, and I'm keeping the weight distributed towards the heel a bit more than the front and up, okay? You're going to do about 10, 12 reps on that, and we'll do the same thing on the other side. You stand, you get loaded, you go back and up. And remember, you're trying to feel the strength in those muscles. The stronger you build your quadriceps and your calf muscles, the stronger the muscles around your knees will become, okay? And relax. So that's exercise number 5. Is it 5? Yeah, I believe it's 5. But the thing about these exercises is this. You're not going to get results if you are not challenging yourself every single day. The things that your physical therapist shows you, it is your job to not just do it when you're at the physical therapy office. You have to practice these things at home as well. So that way, as time goes, you'll be able to do more complicated movements like this as time goes. You'll be able to work your way up to more advanced things. You have to stay consistent. You have to be willing to push through the discomfort because, as you know, the day you had the surgery, the doctors had you moving that same day, and they tell you that they need you to move ASAP, okay? Leave it in the comments. Let me know your thoughts about the things that you just learned. Remember, these movements does not apply to every single person because everyone has different capabilities, all right? This is Sensei telling you that your body is just a body until you make it a temple. Leave your comments, like, share, and subscribe to the channel. And if you want to be a member to the website, head on over to cheerfitcamp.com is $10 a month. Your support helps me to keep doing what I do. Peace.